And the proper rule number 4 is always plan for some overcorrection. No matter the movement you need to make in the clean check, you should always give it a little bit of overcorrection. One of the first challenges you'll face will be anterior crowding resolution. That's simply because most of the people want Invisalign to correct their smile aesthetics and their teeth alignment. They usually don't give a heck about their second or third class occlusion. They didn't even know it was there before you told them. And be sure they'll forget about it as soon as they get out of your office. This is a regular clean check for lower crowding resolution. Doesn't seem bad, right? Well, let's check it out together. As you can see, this moderate inferior crowding has been supposedly solved in the clean check. We have a nice simulation that tells us the teeth will come just straight. But remember, the clean check is just a simulation of the dental movement. More precisely, is a visual display of the force system that will activate the teeth movement. Actual movement can be a lot different. This is the actual situation at the last aligner, which fits perfectly on the teeth. Still crowding? How can that be? In fact, it can be, very well. And this is a great classical mistake of most clean checks, the lack of overcorrection. Many movements, mainly derotations of round teeth, need overcorrection. This means if the canine has a 30 degrees derotation, ask in the comments to make a 40 degrees derotation. This way, you won't have any derotation left at the end of the treatment. If the lower central is displaced 1.5 mm buccal, ask for a lingual inclination of 1.7 mm. This way, you won't have any buccal displacement left. If the lower lateral is derotated by 20 degrees, ask for a 25 degrees derotation. So, you won't get any derotation left. Now, as a general rule for overcorrection, you can take the movement done by a specific tooth or by a group of teeth and see what kind of movement they need to make. Well, at this point, take that specific movement and bring it further, by I'd say 10-20%, depending on the case. So, just always plan for some overcorrection. This will prevent you from doing unnecessary refinements and losing a lot of time. And the more displaced the tooth is, the greater the overcorrection needs to be. Look at that crossbite on the upper lateral. The patient has come to solve that problem. He doesn't even know he's got a posterior crossbite. And as soon as I point that out, he's like, oh, thanks for letting me know, but I just want to get this front tooth straight. So I plan an alignment on the clean check, and it seems fairly good. But the damn tooth remains a fraction of a millimeter behind the upper incisor, and the patient simply does not accept it. Of course, I try to explain him that we've solved the anterior crossbite, and that anyone but I and him will know that the upper lateral is just a fraction of a millimeter behind. But since he's the one paying the fee, I just take new impressions and plan a refinement. Take a look on how I plan the overcorrection here. I just ask in the comments to overcorrect the upper lateral's proclination during the last 3 aligners. I also ask for some extrusion, as that was needed too. And I tell the patient that if he sees the tooth coming too much forward, he can just stop at overcorrection aligner number 1 or 2. But, as I have learned, overcorrection is not just ever enough. The patients focus on their chief complaint and crave the perfect solution of that problem. So if you have to choose, make some more overcorrection is better than making some less. Because anyways, it will relapse a little bit in the retention phase. And pay attention, round teeth just need more overcorrection than squared ones. Upper and lower canines, the rotations should always be overcorrected by, I'd say, 25%. You could even put this in your clinical preferences, and in doing so, you'll automatically get a 25% overcorrection on a canine's derotations, without having to ask for it every single time. See how that lower canine has remained rotated? Well, that's something I could have avoided by simply asking for some overcorrection. But now, I will sadly have to make a refinement. And again, just like in this case, the more displaced the tooth is, the more overcorrection it will need. That upper central incisor is very derotated, and it will need at least 20% of overcorrection for that movement. If you don't plan for it, you'll end up just like me, having to take new impressions to finish the case. And remember, the more refinement you make, the more impression material you consume, the more time you need to finish the patient, the more expensive it will be for you. Of course, you'll need to make use of overcorrection to promptly solve social 6 crowding, and that's of the uttermost importance. But the overcorrection technique is also very useful while dealing with other problems, not regarding anterior derotations or crowding. The rationale is, however, the same. Take this posterior crossbite. Now, on the verge of the things that we have just discussed, what would you ever do while dealing with this situation? Will you just plan for a normal crossbite solution at the end of the clean check? Of course no, you won't. You'll be damn smart and proceed in doing some overcorrection for the expansion you need. Take a look at the clean check. We are planning for a lot more expansion on that side, because we've got the crossbite just on that side. So we have overcorrected the crossbite. But we are not expecting the full dental movement predicted by the clean check to happen. We know those teeth will stop earlier, presumably right where we need them. And just to make sure you've got it clear in your mind, I'll say it again. Always plan for some overcorrection. Overcorrection is the spice of life.